Hi everyone, this is Dr. K. I wanted to quickly talk about some of the things that I was talking to fellow doctors on the social media. So I was reviewing some of the risk factors for COVID-19. Again, there's a lot of controversy. There's still an evolving area of interest. So far, there's a big push about ACE. It's called Angiotensin Converting Enzyme. And the COVID, or I should say coronavirus enters the cell by attaching to the ACE receptor in the cell. So it hooks onto the receptor and gets inside and then starts multiplying. And so far, the researchers mentioned that, hey Lorena, thanks for watching. So far, the researchers mentioned that the more ACE receptors you have in your cells, the less risk of having severe disease. So the more ACE receptors you have, either you will not have the disease or you may have mild disease. Hi, Rolly. So for example, people who have children will have more ACE receptors age-wise. Elderly people will have less ACE receptors, so they're at risk for severe disease or death. Also, people with multiple risk factors, people who have diabetes, high blood pressure, heart problems, cancer, and all these other things, if they have multiple comorbidities, they have less ACE receptors, so they're at risk for death or bad outcomes from the virus. Similarly, sex, people, I shouldn't say people, women compared to men have more ACE receptors. So women tend to have mild disease and men tend to have severe disease or increased rate of death. So that I can explain why. Hi, Rolly. So also they noticed people who are on estrogen, women who are on estrogen, they tend to have more ACE receptors. So for example, people who are above 65, we tend to prescribe hormones to them. Like if they're on estrogen supplementation, then chances are they'll have more ACE receptors and they're more protected. Similarly, men, whether they are testosterone deficient or whether they are in an elderly age group and they're getting testosterone supplementation for whatever reason, they'll have more ACE receptors, so they're at less risk for dying from coronavirus. So that's briefly about hormones, also high candy. So similarly, on the opposite side, if somebody has prostate cancer and they're on a medication to block the testosterone, or similarly women who are having breast cancer and they're on medication that block the estrogen receptors, then they'll have less number of ACE receptors, so they're at risk for bad outcomes from coronavirus. Same thing with diabetes. So people who have diabetes, if it's not well controlled, they have less number of ACE receptors, so they're at risk for bad disease, bad outcomes, longer disease. And the last one is a very controversial one. People who are on what is known as ACE inhibitor. For example, the gold standard medication is something like lisinopril. So people who are on that medication, we're really not sure how it interacts with the ACE receptors and how it would affect the disease. So I'm not sure either. Some doctors believe that if you're on ACE inhibitor, you have to stop it because they think that you can die from the COVID-19 virus. Again, the rationale is not clear, so I'm sitting on the fence. I'm not sure. Hi, Teresa. So if you're on lisinopril, the recommendation for now is to just keep taking it and make sure that you're otherwise healthy. So these are some of the risk factors. If you know some of your family members who have some of these risk factors and you want them to protect in a better way, I would recommend taking high-dose vitamin C, getting more sunlight, working on nutrition. We also offer high-dose vitamin C infusion, something that can help with the immunity. So anything that can boost the immunity for those people would be helpful. As always, I'm available for a private conversation. Feel free to send me a DM or call me. I hope this information is really helpful for you. I look forward to talking to you again. Have a good night, okay?